Good morning to everyone in the Diocese of Orange, and welcome to another edition of Orange County Catholic Radio. We're coming to you from the campus of Christ Cathedral in Garden Grove through the good offices of Immaculate Heart Radio on AM 1000. I'm Patrick Mott. The first topic on the table today, physician-assisted suicide. When many people hear that word, they're likely inclined to think about a person in uncommonly difficult straits, essentially at the end of their rope. But in the case of Brittany Maynard, who was born just up the street from us in Anaheim, we have a young, vital person, a newlywed, with a brain tumor who was given 6 months to live and chose to end her life before that time was up. She said at the time that, and this is a quote, "Death with dignity was the best option for me and my family." She called her illness, again quoting, "This terrible brain cancer that has taken so much from me but would have taken so much more." She moved from California to Oregon last year because Oregon law permits physician-assisted suicide, and California does not, at least not yet. But there is a bill currently before the California legislature that would allow it. Brittany Maynard died last November 1st. Her mother defended her daughter's decision, saying that, quote, "My 29-year-old daughter's choice to die gently rather than suffer physical and mental degradation and intense pain does not deserve to be labeled as reprehensible by strangers a continent away who do not know her or the particulars of her situation." We're here in the studio today with Dr. Kheriaty, who is an associate professor of psychiatry and director of the program in medical ethics at the UC Irvine School of Medicine. Also with us here in the studio is Dr. Vincent Nguyen, a hospice and palliative care specialist and an associate professor at UCI as well. And joining us on the phone is Tim Rosales, a spokesman for Californians Against Assisted Suicide. That group is a coalition of disability rights, health care, civil rights, and patient advocacy organizations. Welcome, gentlemen, to all of you.
Thank you, Pat.
In physician-assisted suicide, we're looking at a real Gordian knot of an issue, are we not? On the one hand, it may appeal to our native sense of personal independence and compassion, but on the other hand, we're talking about playing God, and the Church's position on this issue is quite clear. Let me ask, first of all, why would people find suicide an appealing alternative in the first place? Dr. Nguyen, maybe you'd want to answer that.
Sure. In the society that we live in, we treasure autonomy and in control. So with the bill of having physician suicide gives the people a false notion that they're in control and the autonomy.
I would say, too, from the perspective of a psychiatrist, most people that entertain suicidal thoughts or suicidal intentions don't necessarily want to die. They're not embracing death as some sort of good. What they want is to escape what they perceive to be intolerable suffering, either in the present or, I would say, in the case of someone like Brittany Maynard, anticipating that their suffering in the future will be something that they will be unable to bear. And from my point of view as a psychiatrist, one of the things that we need to do to help individuals in those circumstances is to help them to see that while they may be suffering right now, this is not the right way in which to proceed. This is not the only escape hatch, that there are treatments available for their depression, that in the case of a terminal illness, there is good hospice and good palliative care treatment such that they need not expect to die in intolerable pain or die in a way that they perceive will be completely undignified.
We're going to get into a few specifics of that in just a bit, but Tim, I'd like to ask you this. What exactly does physician-assisted suicide involve? You've had a chance to look at the legal and the essentially practical side of it. What happens in this? This is not a Dr. Kevorkian scenario, is it?
No. So in the instance of the California bill that has just been introduced, this would be a patient going to a doctor that they may not know well, and ask them to determine that they've got 6 months or less to live. And two doctors would have to, under the way the law is written, or the bill is written, would have to agree. That sounds a lot stricter than it actually is, but those doctors would then be able to prescribe that patient a lethal overdose of a drug for the purpose of that patient, an individual, then taking that overdose. That will result in their death. That's the way the Oregon-style model of the law is written. It has been in existence in Oregon for a number of years, since 1999, I believe. We have seen a number of complications and problems arise from it, everything from individuals that with a 40-year history of psychiatric clinical depression to being given this lethal overdose, to a individual woman who was denied a chemotherapy treatment by her insurance company, but instead offered for them to pay for, amongst other things, assisted suicide, the assisted suicide prescription. And that's how they've modeled the California law as we see it introduced in the state Senate this year by Senators Bill Monning from the Central Coast and Lois Wolk, who represents portions of Northern California.
Well, is there an actual danger of this being seen as a cost-effective measure? That's pretty Orwellian.
Yeah, I think that's when you look at a lot of the arguments that have been put out there. In fact, one of the when this bill was introduced back in 2006 and subsequently defeated, Orange County State Senator Joe Dunn, who was in charge of the Senate Judiciary Committee at the time, in his opposition vote to the bill in the committee, he indicated that cost could be something in the future that would be considered, and that was not something that he was comfortable with, because while he may be sure of the intentions of his colleagues at that time with the bill, he could not speak the same for future legislators or particularly in a very cost-conscious healthcare system. So that was one of the concerns he outlined, and I think you hear a lot of that coming from the disability rights community and others, quite frankly, today in their arguments against assisted suicide.
For those of you who have just joined us, this is AM 1000 Orange County Catholic Radio, and we're discussing physician-assisted suicide with Dr. Aaron Kheriaty, Dr. Vincent Nguyen, and Tim Rosales. We've talked so far mostly about the patient's side of this, but what does this do to doctors' Hippocratic oaths, Doctors Nguyen and Kheriaty?
Well, we know that most physicians certainly still oppose the notion of getting involved in assisted suicide, either individually or collectively as a profession. The California Medical Association has voiced strong reservations about this Assembly Bill 128 and prior efforts as well to legalize assisted suicide in the state. The American Medical Association has a long history of opposing assisted suicide. And this goes all the way back to, as you mentioned, the Hippocratic Oath, which has a specific line in it that prohibits the Hippocratic doctor from administering a deadly drug, basically getting involved in assisted suicide. And the reason for that is very clear if you understand the ends and purposes of medicine. What is the medical enterprise about? It's about health, healing, and well-being. The ends or goals of medicine are to try to help people to heal and not take someone who's healthy and do something to make them worse. And certainly towards the end of life, palliative care and other aspects of medicine, we have to recognize that that death is going to happen eventually. But we don't aim at or embrace death as some sort of good. We try to help people live well to the end of their days and then die well in their last days. But this idea of physicians basically becoming killers is really anathema to everything that medicine has stood for in the West for the last 2,500 years.
Yeah, from my perspective as a palliative care physician is, the role of the physician is there to benefit the sick. And by promoting physician suicide, it certainly changes the culture and changes the role of the physician from being the healer to the killer. And it also, I think, will very much destroy or at least undermine the patient-physician relationship, where patients come to us, trust us that we're going to do everything we can to provide the best care possible to our patient. And having this alternative option, it leaves a lot of unknowns, and oftentimes, if it's a lot easier, as you can imagine, to take the path of least resistance for patients who we don't want to take care of anymore, people who just cost too much in time, spend too much time, and I'm really pressured. I mean, I can see the slippery slope from there, and we have to be very, very careful when it comes to this. And the role of the physician, again, is as a consoler, a healer. And we're there to be with the patient and family during the course of the illness. And this is what we're called to be as physicians.
I can also see just an absolute swamp of liability issues arising from all this law that has not been written or even dreamed of so far.
Sure. Well, one of the issues that I see, Dr. Nguyen mentioned what I think is a very real, practical, slippery slope in terms of how patients trust their physicians. What is the motivation of my physician when he's suggesting or making a recommendation? But legally, I see also a relentlessly logical slippery slope. What I mean by that is once we enshrine in law the principle that under some circumstances, suicide is acceptable or suicide is a reasonable solution to life's difficulties or life's problems, then the fences that we try to erect around it, like the ones in this law, you have to be 18 years old, you have to have mental capacity, you have to have 6 months or less to live, according to two physicians. Those laws are going to, or those restrictions are going to be eventually unmasked as arbitrary, right? Which is exactly what's happened in countries like the Netherlands and Belgium, where the opening wedge was assisted suicide allowed under some narrowly defined circumstances, and then moving from there to involuntary euthanasia.
Please stay with us. When we come back, we'll be talking more about assisted suicide with Dr. Aaron Kheriaty, Dr. Vincent Nguyen, and Tim Rosales. This is AM 1000, Orange County Catholic Radio. Welcome back to Orange County Catholic Radio, AM 1000. We are here discussing the subject of physician-assisted suicide with Dr. Aaron Kheriaty, Dr. Vincent Nguyen, and Tim Rosales. I found a quote from the former Supreme Court Justice Oliver Wendell Holmes, who supported, if you can believe it, eugenics in his time for those he called degenerate offspring. He said three generations of imbeciles are enough. Now, once we start talking about suicide for people who are able and willing to this is the wrong word, but prescribe it for themselves, would it be out of the realm of possibility that we might even be straying into the area of eugenics?
Absolutely. Going back to why this is such a popular topic is people, when they think about death and dying, it conjures up pictures of fears of losing control, fears of what the unknown, fear of being a burden to their family, fear of breaking their heart, fear of suffering. So there's so much fear. And so isn't it great to capture people's fear and expand this even further? So, what society will tell us is one thing, but in the practical reason in what we do in palliative medicine is to address those fears and to shift away from these fears that they cannot control to things that they can control, such as, utilizing this time to be assured that they're going to be cared for by the best medicine possible to help guide them through their suffering or to what pain may lay ahead. And when we talk about pain, we're not talking about just the physical pain, but we got to remember the whole dimension of a person, which can constitute their emotional, their psychological, their social, and a spiritual perspective. What medicine has done so well is we focus so much on the physical, but we forget about the other four components. So from the palliative care, the hospice holistic approach to medicine is we do not forget about the person and their extended family who are going through this serious illness. And when we push for physician-assisted suicide, we're not alleviating the suffering from the patient, but we're alleviating the patient who is suffering. So I just want to leave that as a little piece that maybe Aaron, you could jump into.
I can perhaps comment on some of the social dimensions that you raised with this issue of eugenics. There's a strong strain in American history, a very ugly strain of this sort of thinking that remains alive and well today, and in many respects is part of what is driving this push for assisted suicide. And I think it's important that we get past this notion that people are making an entirely private choice that won't affect anyone else. It's just between me and my physician, or me and my family and my physician. We know from research on suicide that this is not the case, that suicide has social effects, especially for widely publicized suicide. So we can go back to the well-known case of Brittany Maynard. This was a woman whose death was, in some sense, romanticized. It was publicized widely. And what we know about suicide is that there's a sort of social contagion effect to it. You know, when someone like Maynard says that my life under these circumstances is not worth living, or when the laws of Oregon or Washington say lives under certain circumstances are not worth living, that law is a teacher. And that example set by people who avail themselves of that option also is a teacher. So other vulnerable individuals, young individuals that are contemplating suicide, people that are suffering from psychiatric disorders that may incline them to think about suicide, they are going to be impacted by that. This has been well researched and well studied. It goes by the name of the Werther effect, which goes back to a novel written in the 19th century by the German author Goethe, who depicted in this story the suicide of a young man using a pistol. And what they found in Germany after it was published is all kinds of young men whose hearts were broken, thwarted love, committing suicide using the same means. And again since then, over the last 150 years, this has been studied by social scientists and found to be the case, that suicides do set an example that's followed by other people.
For those of you that have just joined us, this is AM 1000 Orange County Catholic Radio. We're discussing physician-assisted suicide. Pope John Paul II was cited at the end of his life as providing an excellent example of what it is to have a good death. To die with real dignity. What good can come out of seeing a terminal illness out to its very end?
I have witnessed healing in the face of no curing. I mean, this is an opportunity. This is a silver lining that we don't see. People think of death as something that is so finalized, but it's not. It is also an opportunity, a time of healing, a time of reconciliation, a time for patients and family to come together and say, look, I love you. And to say, thank you so much for being here with me. Thank you for putting up with me for all these years. And this is a time of reconciliation, to be able to say, look, forgive me for the time that I have not been the best dad in the world. And allowing your family to say, look, we haven't been the same too, but would you forgive us? So I have so many of these experiences, and I guess those experiences are my teachers. And I feel that it's my obligation to share these good news to those patients who are going through their suffering, feeling that there's no hope and how can anything be good out of this. There is so much healing, and death isn't, after a person dies, it doesn't stop. But there's also the family who are living post-death of the person's death, and they need to continue to heal as well. I think suicide takes that opportunity for the patient and family to completely heal. And let's guess for the family, because let's say you suicide, you do something, but there's still that lingering ugliness that still continues after a person dies. And again, I speak from my own experience, speaking for caring for thousands of patients over the last 20 plus years who have gone through this and who have asked me to help them ease their pain and burden in their journey.
I imagine suicide could actually introduce a trauma into the family that would not have been there had the person lived out his days to the end.
Oh, it certainly does. I recall a recent case of an individual who came to me requesting physician-assisted suicide and believing that he might find someone at my institution to help him. And when we disabused him of that notion, we had a meeting with his family, and one of his estranged children told him very clearly that, Dad, if you do this, we're never going to get over it. Suicide tears at human relationships. It tears at the social fabric. It is a violent act. It's not a sort of peaceful way of dealing with difficulties at the end of life. And you mentioned John Paul II. I think he's a marvelous example of the Catholic Church's balanced view of how to approach end-of-life care, because I think even Catholics have mistaken notions in one or another direction. So on the one hand, some Catholics mistakenly believe a notion that I like to call vitalism. That means that I need to avail myself of any and all medical interventions and try to live as long as I possibly can, even if those interventions have very little chance of success. And that's not, in fact, what the Church teaches. You can contrast that with, on the other end of the spectrum, a sort of quality of life ethic that says, well, gee, if I'm impaired in some way or disabled in some way, then, and the quality of my life is something that I perceive to be too poor, then let's go ahead and just do something active to end it, overdose on a barbiturate. And the Church's position is in between there, that we do maintain some autonomy at the end of life, that we do have the choice to forego useless or excessively burdensome medical treatments. And that's precisely what John Paul II did. He pushed, to the end of his capacity. He continued to be a witness to how to suffer well and how to be a shepherd and a leader, even when the effects of the Parkinson's began to manifest. On the other hand, in his last days, when his infections and other problems began to overwhelm his body, he chose not to pursue excessively burdensome treatments in the hospital, but to retire to his apartment and die at home in prayer and in the company of his closest collaborators. It's a beautiful witness to a good death as Catholics envision it.
One of the reasons we're discussing this subject today is there is currently a bill before the California State Legislature that would mandate physician-assisted suicide in the state of California, much like it is in Oregon now. We have Tim Rosales on the telephone. He is a representative of Californians Against Assisted Suicide. Tell us a little bit about what sort of political and popular support or lack of support that this bill has in the medical community and in the wider community.
Sure. I think that's a great question, and I wanted to add to what the doctors just noted that nothing in the bill that's been proposed in California would require that family be present or even notified if someone requests a lethal overdose from their physician. And so I think that's something that to consider in the context of what the doctors noted in their remarks. In California, there has been previous attempts to legalize assisted suicide back in 2006, 2007, 1999, and then there was a ballot measure back in 1992. All of those efforts have failed due to bipartisan opposition, both from Democrats and Republicans in the legislature. And as I noted most recently in 2006, 2007. This year, legislation has been introduced. It is sponsored by two legislators that represent the Central Coast and northern part of California. It is sponsored by an organization called Compassion and Choices, which is formerly the Hemlock Society, the former name that they went under. And they are trying to capitalize on the recent news and publicity surrounding the Brittany Maynard death and her well-publicized situation. There is some support in the legislature right now. There are a handful of co-authors, but certainly I think that those on the opposed side and the opposition, which includes organizations like the California Medical Association, the Association of Southern California and Northern California Oncologists, the vast majority of disability rights organizations, and of course, faith-based organizations such as the California Catholic Conference, also Catholic hospitals, and those types of organizations have all come together in opposition to this current legislation. So I think that looking out at the prognosis for this legislation is that it's going to take a very coordinated, full, and aggressive effort to defeat assisted suicide as it's been introduced into California this legislative cycle. Certainly the proponents have a lot of money and a lot of resources on their side. I think that those of us on the opposed side have strength in numbers and can be very effective reaching out to our legislators, our state assembly members and state senators that represent each of us, particularly those in the Orange County area and in your listenership, can reach out to their legislators, whether it's through calling their district office or their state capitol office in Sacramento, and letting them know that they oppose assisted suicide legalization in California. You don't have to get into a big debate or conversation with any of these offices. They just simply want to know and hear from their constituents. But I think we're in for a fight, and we really need to be, I think, focused and well coordinated, and and also get the message out. And that's why I appreciate you having all of us on your program today.
Well, Tim, thank you very much for being on with us. I'd also like to thank Drs. Kheriaty and Vincent Nguyen for being kind enough to join us today with their thoughts. We'll likely visit this again as the bill nears a vote. Stay with us. We'll be right back.